The name of the disorder I'm going to be presenting today is schizophrenia. Broadly speaking, schizophrenia presents itself as cognitive and behavioral abnormalities, often associated with emotional symptoms and resulting in difficulty functioning in one or more important areas in life. While doctors and researchers aren't certain what specifically causes schizophrenia, they have identified some risk factors and have correlated it with certain variables. For example, you are more likely to get schizophrenia if a relative has it, and the closer the relative is to you, the higher of a risk factor that is. So, an identical twin, for example, would be the highest risk factor there. Researchers have also found a link between taking certain drugs, such as methamphetamine or LSD, and developing schizophrenia. And with that one, the risk factor is higher the younger you are when you take those drugs. Studies have also shown structural differences in people with schizophrenia, such as larger than normal ventricles. One study that I found looked at monozygotic twins, where one twin was diagnosed with schizophrenia and the other wasn't, and they did MRI coronal brain scans. So I starred the twin that was diagnosed with schizophrenia, and you can see that the ventricles are a little bit larger. And looking at their data numerically, it shows the percent difference in the ventricles sizes between the twins. For the right lateral ventricles, it ranges from 16 to 25%, for the left lateral ventricles from 14 to 18%, and for the third ventricles from 8 to 23%. Neurochemical abnormalities have also been associated with schizophrenia, particularly abnormal dopamine transmission, which is significant because that's primarily what is targeted by antipsychotic medication, which I will get into later. Schizophrenia cannot be diagnosed by neuroimaging or any kind of physical test, so doctors diagnose the disorder with the DSM. And the DSM criteria is long. They list a lot of different symptoms. But the first set of symptoms that are kind of the main ones that they look at are delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. In order to fit the diagnosis, a person has to have two or more of those things, and at least one of their symptoms must be delusions, hallucinations, or disorganized speech. They also have to have impairment in either work, interpersonal relations, or self-care for a significant period of time following the onset of their symptoms, and their symptoms must have been present for at least a continuous period of 6 months. Schizophrenia presents with both positive and negative symptoms. Positive symptoms include hallucinations, auditory, visual, olfactory, gustatory, and or tactile hallucinations, delusions, persecutory delusions, referential delusions, somatic delusions, erotomaniac delusions, religious delusions, and grandiose delusions. Other positive symptoms include confused thoughts, disorganized speech, and concentration issues. Negative symptoms include a lack of pleasure, trouble talking, affective flattening, which is a lack of emotional expression, withdrawal, and avolition, which is defined as the lack of motivation to go after really important life tasks. In my experience, at the beginning of a schizophrenic episode, symptoms will be present, but they'll be more subdued to the point where they might even be unnoticeable to somebody who isn't aware or doesn't really know what to look for. But as an episode progresses, the symptoms will grow more severe. It is important to note that not everyone with schizophrenia has every symptom. Most individuals with this disorder have varying combinations of symptoms, and not everyone with this disorder has their symptoms all of the time. There is currently no cure for schizophrenia, but there are treatments. Antipsychotics are the most effective treatment for schizophrenia. However, it can be difficult to get someone with schizophrenia on treatment because a lot of the time these people aren't convinced that they have a disorder, specifically one that requires medication. But if you can get someone with this disorder to take medication, the medication works by blocking the dopamine D2/3 receptor to lessen the abnormal dopamine transmission that I mentioned earlier. Researchers think that the ventral striatal regions of the brain are particularly involved in this. And in addition to the medication, therapy can help with symptom management, but medication is really key to managing this disorder. As far as the outcome, people diagnosed with schizophrenia 10 years after diagnosis, 50% are recovered to the point where they can function independently and live on their own. 25% have improved, but they still require a strong support network to live their lives. 15% have not improved, and most of those people are hospitalized, and 10%, unfortunately, at that point will have committed suicide. Outcome is affected by what an individual's life was like before their diagnosis, and it is strongly affected by the amount of time that goes by between onset of symptoms and when an individual is diagnosed and receives treatment. So the sooner that someone can get treatment after symptoms arise, the better off they'll be in the long run.